Would you believe me if I would tell you that over 400 women die each and every year due to maternal deaths? Yes, your guess is as good as mine. It's impossible, right? Trust me, it's possible. In a continent called Africa, in Eastern Africa, we have a country called Kenya. It is estimated that over 400 women usually die each and every single year due to maternal deaths. Take a breath. Take a breath. My question is, how is this even possible? And remember, these are only reported cases. 400 is the number. So, how did they come up to this 400? According to the World Health Organization, within 100,000 live births, a specified period of 1 year, each and every country should give a number of how many deaths happen, either before, during, or after the pregnancy period. Kenya alone, the numbers are up to 400. Give or take, 2 women die each and every single day. People of the internet, ladies and gentlemen, what are you doing about it? What am I doing about it? What is the government doing about it? For those who are joining me for the first time, my name is Kuguru87. I advocate for these words: no mother should die during childbirth. Join me as I ask the big question today: how can we improve our healthcare system so that we prevent these deaths to happen either before, either during, or either after childbirth? Because those numbers are very, very, very high. And do you know what is happening in Kenya right now? We are all singing, we are headed to Singapore. Ladies and gentlemen, people of the internet, those numbers are so worrying. And I'm only talking or speaking about numbers that have been reported. What if those numbers are double? What if those numbers are double? Someone whispered the other day that it is estimated that up to 4 or 5 women die each and every single day, just alone in Kenya. But it is reported that it's 2, according to the World Health Organization data. Today we're not speaking about that. That's another topic for another day. Today what we're talking about is how can we improve our healthcare system to reduce these numbers? What can the government do for us? What can us, the individuals ourselves, our spouses, our moms and our dads do to prevent or reduce these numbers to the bare minimum? First and foremost, I'd like to urge us, if you know anyone, if you've seen anyone, if your loved one is pregnant or expectant, kindly, it is very vital, it is very important for them to start attending the prenatal care. I know some of you will say that I started attending it after 2 months. According to the World Health Organization, the minimum times of someone who should already pregnant or is expecting a child should visit the hospital, the minimum requirement trips should be at least 8. Some of us start going after their 1 month, 2 months into the pregnancy. I know there are challenges, like maybe you're living in the rural, these health facilities are not there, these health facilities are not well equipped, these health facilities are understaffed. But it is very vital also for the county government, for the national government, together with the Linda Mama initiative, if it so exists still, and the social health authority, to make sure that the women and the mothers and the midwives who are working to these health facilities go and sensitize and what you call a civic education to the people in the rural areas about the importance of going and seeking medical assistance or health assistance earlier. Why am I saying you should visit the doctor or your gynecologist early? It's because you might be having underlying issues and you're not aware. The cases go from diabetes, cases go from hypertension, cases go from HIV, sorry. Cases go for some chronic disease that underlying and they cannot be detected at later stage. Because once these things have been detected early, it is easy manageable. They can prevent these deaths because most of these deaths happen due to these particular cases. It is very vital that you go early. Another instant is once you've already finished or you've already started going to the clinic earlier, when those underlying issues have been detected, they can start being worked upon by either the health service provider that is in that particular facility, or if you've managed to get a gynecologist or an obstetrician. This is because these underlying issues will be detected early, and during that pregnancy period, they'll tell you the kind of medication you're supposed to take, the kind of balanced diet you're supposed to take, the kind of treatment you're supposed to receive, the kind of exercise you're supposed to do. Because a lot of us, since they do not go early, they end up even. I've came across another lady where you found them smoking. Some of them, you found them taking alcohol. And they didn't know, the doctor said. In fact, there's this myth the other day that people said there's a certain beer that they should take when they're still pregnant. How true to that is, I don't know, because the question is, how little is too little and how more is too more. There's no scientific or biological evidence that has proven that because you'll take this particular beer, then it will affect you or it will not affect you. I tend to say those are all hearsay for that particular matter. Another thing, once you've already started undergoing this particular prenatal care, now let's come to the time that the mother has already given birth or is about to give birth. Another education is, where are you going to be sleeping with the kid? Do you have enough clothing? Do you have enough, apart from the clothing, are you sleeping under a net with your kid? Are you having a balanced diet, as I earlier said? Is the kid having enough milk? Most of the parents, mostly in those rural areas, do not usually check on this or do not usually work on this. Today I saw another clip where someone was saying there's what you call a free birth. Free birth is when people decide that they're no longer going to give birth in the hospital. They give birth back at home. I'm so against it because the world of today is not the world that was back there. So another main issue is why you should go and visit the health facility is when, before you leave this particular hospital or on this particular facility, they shall have already checked if wherever you're going back home, will you get a proper diet? Will the kid be able to receive all these kind of injections? Because remember, maternal death usually happen either before the delivery, during the delivery, or after the delivery of the kid. That's according to the World Health Organization. So you've already given birth, you went all through these checks, and now you've already given birth. The question is, after giving birth, how well do you also take care of yourself as the mother and the child? Remember, our main core goal is that no mother should die either before, either during, and after pregnancy. So the question of today, what are we going to do about it? What are you doing about it? What am I doing about it? Another issue where we ask ourselves and we should make sure that we put a lot of effort is this particular health facility that we want to go to. Are they well equipped? The ball now goes to the county government. The ball now goes to the national government. Are they well equipped? It is very unfair for a mother to go into a delivery room and you'll find chances that they do not have a blood bank, they do not have the oxygen tanks, they do not have proper beds, they do not have proper midwife staff who are there. What happens when an emergency arises? What happens when something goes wrong? Because remember, your body doesn't have a repair spare part. It's not like you're building your car or you're doing some maintenance somewhere. If something goes wrong, at the end of the day, they'll go and buy a new spare. I leave this ball upon the government of the day. Are these health centers or these health facilities, are they well equipped to manage such kind of cases? Because the other day, I heard someone saying in the rural areas, you'll find most of the mothers there, they're giving birth to 3 kids, 2 kids. Some of them even never knew that they have twins or triplets for that matter, because they never visited the hospital before. They only came to realize it when it was around 6, 7, 8 months down the line. So is that particular health facility ready, equipped to make sure that the mother delivers these triplets, these quadruplets, these twins well, and they'll be of good health, and the mother will also remain alive. We don't want those cases where these kids survive the mother died, because eventually, to some extent, the children might end up even losing their own lives. So the question is are these facilities also well equipped with the necessary tools, with the necessary gadgets, with the necessary equipment? Last but not least, some people also say that now this is the postpartum cases. Have you been taken through after you've already given birth? Maybe these are the kind of preventive measures that you need to undertake as a parent. There's some people who are not educated well enough to be told, now because you've already given birth, you need to take some break doing ABCD. I was shocked the other time when a lady said that they gave birth like 2 days later. They gave birth, then after 2 days, they were attending to their garden. 2 days later, they were back to the office. And I was wondering, is it a matter of life and death? People of the internet, ladies and gentlemen, I know it's an argument that we can never finish today. It's a debate that we can never finish today. But to some extent, back in the rural, they gave birth like yesterday in the morning. Today in the evening, you'll find them in the garden attending to their chores. Simply because they don't have anyone to come and assist them. So they cannot sit down and relax and wait for someone to come and attend to them. These kids, chances that they lack proper breastfeeding, chances that this mom or mother will be malnourished or will not be having proper feeding program, and to some extent, this might end up being very fatal. Kindly, ladies and gentlemen, people of the internet, let's make sure that our mothers are feeding very well, and the kids are also feeding very well, and the mother also make sure that the kid undergoes those first, second, and third tests or injections immediately after the birth of that particular child. This will help the child today and in the future. Currently, I think we have more than 6 or 7 injections a kid is supposed to undergo: measles, hepatitis, etc., etc. So the call to action is that the government should also come in very strong. The county government should come in very strong, and ourselves and the citizens of Kenya, we should come up to arms and fight for the women's right. 400 is a very big number once our women are dying. There's nothing as hurting as you are letting someone that you know, your loved one, your mom, your sister, your cousin, to become a statistic. I'm a victim and I know what I'm talking about. When a nation loses a mother, it not only loses a mother, it loses someone who was dependent of other people. There are people who are dependent of this particular individual. There's a kid who will be raised without a mom. There's a man who will remain someone without a husband. There are people who remain without an auntie. There are people who remain without their nieces simply because of a certain step wasn't undertaken. Either the particular individual never went to get the proper medical care, or the particular health facility that they went to ended up disappointing them, yet they trusted them. Ladies and gentlemen, in our next video, we'll be checking step by step which are the main causes of the maternal death currently in Kenya. Thank you very much, and if you find this very educative, kindly share your comment section down there. Check you out in the next video. And I will